everyone. My name is Christy Scheffler. I am part of the National ECE Workforce Center, and we are really excited to join and talk with you today. Following our recent research to practice brief, benefits offered to center-based early care and education educators, we're glad to be talking today with you together about ways that states and communities are thinking about benefits for the ECE workforce. Um, our work is supported by a grant from the Administration for Children and Families, but this statement is here to share that we don't necessarily reflect the views or opinions of our federal funders. For those of you who are new to meeting with us, the National ECE Workforce Center is a joint research and technical assistance center, and we support states, territories, tribes, communities, and program leaders to improve the systems that support the ECE workforce. And right now, specifically, we're focused on supporting competitive compensation and clear and accessible career pathways for the existing workforce. One key feature of all of our supports is that they're grounded in our systems change framework. And each service that we provide includes this unique blend of research and TA. We do provide services across a continuum of universal and targeted and intensive supports. And today we're combining those. We're building on one of our universal resources, the Research to Practice Brief, to provide you with this targeted opportunity to come together and meet and engage with peers and our team to hopefully help us all learn something and walk away ready for action. For anyone who has not joined one of our coffee chats so far, coffee chats are informal opportunities for system and program leaders to actively engage in discussion around different topics. Each coffee chat does focus on a specific product that's been released from the Workforce Center, and the authors join us for these discussions, walk us through a brief recap of the topic we're talking about, and then we spend the majority of our time together in smaller groups so we can share and learn from colleagues. If it would be helpful for you, you can turn on closed captioning in this meeting by clicking on the More button on your Zoom bar, and you can select which language you would like. Since coffee chats are set up as a conversation rather than a webinar, if you're comfortable and if your technology allows, we do appreciate having cameras on. During the brief recap portion in the beginning, we do ask that microphones stay muted, but then once we shift to our smaller conversations, we'd love to hear from you directly. And with that, I'm going to turn it over to Sarah Amadon, one of the authors of the brief that we are discussing today.
Hello, everyone. I hope everyone is well. I am Sarah Amadon. I'm a senior research scientist at Child Trends, and I'm here today to walk us through the research to practice brief entitled Benefits Offered to Center-Based Early Care and Education Educators. And I believe we can share that in the chat as well for those who might not have have had the chance to review. Go to the next slide. Great. So this is a brief, once again, which is a part of our Research to Practice brief series. And first, the brief was informed by a scan of the literature on the importance of benefits for educators and other types of workers as well. Next, we conducted analyses using the National Survey of Early Care and Education, which was fielded in 2019, which is a nationally representative survey of childcare providers and families. And we use the center-based survey, so the findings in the brief today only account for centers, and I'm happy to talk more about that. Centers in the survey include the diversity of types of centers in the U.S., including community-based programs, Head Start and pre-K, those at religious institutions, and those sponsored by employers as examples. They also have different funding streams and budgets, and center directors or other administrators responded to the survey that we'll be sharing results from today. And finally, we also examined state innovations related to supporting providing benefits to educators. And these were derived from a variety of sources, including the center's AI scan of Child Care Development Fund plans and the Center for the Study of Child Care Employment's Workforce Compensation Policy database, in addition kind of to other late-breaking innovations that we hear about that states are offering. So, what does this brief talk about? Next slide. Oh, that is the next slide. My apologies. Okay, so in terms of background, for today, benefits refer to things like paid time off, health insurance, retirement plans, can also be free or reduced tuition offered at the center, or supports for professional development. These benefits can be costly to offer. Things like health insurance and retirement plans obviously have a real cost for the employer to provide, or they can be challenging to implement for things like paid time off when we have different workers and schedules to contend with. Employees do really rely on these benefits for promoting physical, emotional health and also physical well-being. And this is for educators, but also for all types of employees. And benefits also support job stability and satisfaction, so they can promote things like worker retention. Next slide. So what did we find? So we looked, this slide shows us the proportion of centers that offer different types of benefits. And again, this was from the National Survey of Early Care and Education. As you can see in the note there at the bottom, these findings present 2019 data from about 121,000 centers in the United States. And it shows the percent of centers that offer the benefits that the directors were asked about. Now, note that these were the only benefits that directors were asked about in this survey. So we unfortunately don't have information on things like paid time off, for example. And we do have a lot of information on professional development supports, which can be thought of as kind of an educational benefit, but um, might not have some of those might not often be thought of in regard to the benefits the staff received. So at most, we see 58% of centers offered one of these types of benefits, and that was coaching or mentoring offered to staff. The least prevalent benefit offered was then paid time off to participate in professional development. If we walk back over to the left, we see that 57% of the centers offered health insurance, 50% offered retirement plans, and 52% offered free or reduced tuition at the center. Now, importantly, these were things that directors said they offered. We don't know whether or not that educators themselves actually used the benefits or took them up. Again, these were just if they were offered. Next slide. As a next step, we then looked at the findings considering funding stream that the centers received. Now note that the categories we look at here aren't mutually exclusive. So for example, centers that had served at least one child receiving CCDF funds also could have received state pre-K or public pre-K funds. So these are not mutually exclusive. It's just whether or not the center served at least one student receiving these types of funds. So if you walk through, we see that the dark blue CCDF, the green is public pre-K, the blue is Head Start, and the gray is no public funding from any of those sources. Again, it's the same set of data. And those dashed lines represent the average levels that we saw on the previous slide. So in general, the proportion of centers that offered those benefits. So in general, we see that centers with pre-K or Head Start funding were more likely to offer retirement plans or health insurance benefits than those without. The rates for the offer of these benefits were lower for centers with CCDF funds or those without any public funding. But on the other hand, if we look at free or reduced tuition at the center, that was much more common for CCDF centers or those without sources of public funding. But this, of course, kind of makes sense, given that tuition may already be free at public pre-K or Head Start centers, right? So it's just some of this might be a natural artifact. Some of it might due to the fact that we have a higher cost for some of these benefits that the public funding might be supporting. Next slide. So we're now going to turn to some state innovations that we learned about during our scan of CCDF plans and the Center for the Study of Childcare Employment's policies database. So starting with Missouri, we are happy to describe some of these programs. And in Missouri, there's a subscription to what's called Show Me Childcare Resources, which is an initiative of Childcare Aware of Missouri, and it provides telemedicine or to licensed childcare providers for free in St. Louis and at a reduced cost to the rest of the state. And these costs range from about $8 a month to $14 a month, the latter of which, so that $14 includes teletherapy with telehealth. I'll also note that these programs, there are links to these programs in the brief itself. If you do want to learn more, we did try to provide direct links to where you can learn more details. Next, in Kentucky, the Child Care Assistance Program now allows access to child care subsidies, regardless household income, for child care employees working 20 hours or more in a licensed child care center or certified family child care home. So kind of so all these childcare educators now can have access to subsidies, regardless childcare of household income in Kentucky. Again, that's another sort of like benefit, kind of like for your reduced tuition at the center that we see the state of Kentucky offering. And finally, and this is a really recent policy, so we have fewer details on it, but Arkansas now is supporting retirement system access via the Arkansas Teacher Retirement System for educators at licensed providers receiving state or federal funding. Again, it's kind of a new policy, so we haven't seen it. We haven't seen it implemented yet, but we have seen this is a bill that was really recently passed, so kind of hot off the press. So there are other state innovations in addition to these, and we actually are going to have another brief coming out soon within the next month or two, which highlights some more of these types of strategies that states or programs can use. And in this next brief coming up as well, we also talk more about family child care providers, because unfortunately that was not included in the NSECE. So we have a couple of slides for consideration. So to kind of close our gaps in understanding to help us kind of have a better lay of the land in terms of benefits to providers, we can ask some of these questions. How do family child care educators access benefits, and what supports could facilitate access? So again, we only really know we have a lot more information about center-based provider educators in this presentation today. And in general, family childcare educators or owner-operators or small businesses, how could we learn more about supporting their access to benefits with kind of lower overhead and lower financial resources to be able to offer these benefits? We also know much less about educators' needs and preferences when it comes to benefits. So what do educators say they want? What would really help? What would they prioritize? Do they want the more paid time off, or would they like, for example, more professional supports, and what types and what mix? How can cost modeling strategies also appropriately account for the cost of providing these benefits? As we think a lot more about pay parity, we could also think more about kind of, benefits parity. And as we're thinking about cost modeling and accounting for all those costs to support wages, to support benefits, how can we make sure that these cost models are appropriately accounting for benefits as well? And then we have a couple of other considerations for state leaders and center-based program leaders as well. So for state leaders, we could ask whether current cost models, again, support providing these comprehensive benefits. Like, how can we ensure, what strategies for cost modeling can we ensure that they do? Could current programs that provide benefits to state residents also be expanded to include ECE educators? For example, in the Kentucky model, we see now that, and other states are taking this up, where childcare subsidies are offered to childcare educators, often ignoring those eligibility thresholds for things like income. So, what other programs exist like that we could help support educators by expanding benefits in novel ways? And then for center-based program leaders, we could consider what kind of benefits, we would encourage these leaders to ask what kind of benefits your centers does offer. Are these the best supports for your educators? What sources of funds do you use to pay for benefits? Are there other funds that you could access to try to support the staff in your programs? And then also you can ask what benefits your staff would appreciate receiving. Again, going back to making sure that kind of the needs of these staff are being matched by what is being offered to really engage in what would support their retention, their well-being, their health, and their mental health.